We're talking about liver disease, and the reason we chose this topic is because Dr. Karin and I, we've been getting a lot of questions about liver enzymes, liver disease. It's a common question, it seems, in springtime. So we thought, why not just kind of pull a bunch of information together and just give you one massive response to all your questions. Now, if you're tuned in, then I'm guessing A, that your dog has liver disease, and B, that you have probably tried a lot of different things. So just SAM-E, milk thistle, liver supplements, Denamarin from your veterinarian, maybe ursodiol, dandelion. And if you're tuning in, I'll bet that you have maybe found that those weren't working for you as well as expected, which is unfortunate because we don't really have a lot of drugs specifically to help the liver. I would actually say we have none. We have drugs that kind of treat autoimmune disease, and if it's in your liver, well, then it'll help. But in terms of actually reversing liver pathology, we don't have the drugs. So it's kind of on us as pet owners. And yet, so it's disheartening when you try these supplements and they don't help you out. But today, we're going to give you a message of hope, which is that you can get these dramatic results in liver disease. The most important consideration, though, is something, it's not whether a supplement, protects liver cells from damage or stimulates bioflow or is anti-inflammatory or whatever. The most important determinant of whether your supplements are going to help your dog or cat is what's their circulatory impact on the liver, and what does your animal actually need that circulatory impact to be? This really never gets discussed in anyone's supplements, well, except for maybe Karin's and mine. But it turns out to be all important. So just as an example then, let's say you swat your thumb with a hammer. What's the right thing to do with that thumb when it's all painful? Are you going to be taking glucosamine and PEA and boswellia? And no, you're going to address the immediate concern of it being swollen and red and painful. Like what do you want? You want less blood in that thumb, quite literally, quite graphically. So that's where the acronym RICE comes from. R is for rest, I is for ice, C is for compression, although I wouldn't be squeezing on that thumb too hard. And then E is for elevation. Literally, you're trying to get the blood out of that acutely inflamed structure. Okay. So the right thing to do is defined by what the blood flow impact is. Now, what about, say, 2 or 3 weeks later? Can we stop thinking about blood flow? And now we can start, just kind of throwing supplements at our sore hand joints willy-nilly? No, we still need to think about circulation. Think about if you've injured yourself. You have that initial stage where you're all inflamed and sore, and so you've rested it and iced it and compressed it and elevated it. What are you like 2 or 3 weeks later? You now, instead of it hurting with every little step, now when you get up, you're like, I'm really sore. And then as you walk around, you warm up out of it, right? That injured site is now better the more you're pumping blood fluid through it. So even in chronic inflammation, blood flow is still the all-important determinant of whether you're going to feel better. And that doesn't change if we're talking about a liver versus an inflamed joint. So how a treatment impacts blood flow is the all-important determinant. Doesn't matter what else. It doesn't matter what the online Google search says that a supplement does. If it doesn't have the right blood flow impact, it's not going to help. Okay. Let me give you a case, a liver case, instead of the swollen hammer thumb case, in order to kind of help bring this point home. And, we will be talking about, 3 or 4 cases, over 4 of them, I guess, over the course of the webinar. Some of them are mine. Some of them are Dr. Karin's, because we have been practicing together for a long time, over a couple of decades. So you'll get to see Dr. Karin at work And she is a little medical genius. Okay. This case, though, I think predates when I met Dr. Karin in Portland, Oregon. And this is Madeleine. Madeleine's a 15-month-old female Bouvier de Flanders. So she was a lot healthier in that photo. But when I saw her, she was not particularly uh, feeling that good. Why? Because she was in liver failure. So she had a congenital microvascular dysplasia. That was the diagnosis she'd been given. They told her that dog would not live very long, probably just a few more months. And that was easy to believe when we're looking at Madeleine because she had a lot of fluid in her abdomen already, which, as some of you may know, can be a sign of imminent liver failure. She was anemic. And some of you who've read your blood tests on your dogs, you may have seen the word microcytic. What does that mean? Microcytic means that the red blood cells are getting shredded as they're going through blood vessels. That's actually really important. And it tells us what's wrong. More on that in a second. She was not eating well. She was throwing up. She had urinary incontinence. She was emaciated. And because of that loss of muscle mass, she was very weak, couldn't jump on and off furniture. And maybe like you, she was using things that seemed reasonable. She'd heard dandelion's great for the liver. Dr. Karin and I talk about how dandelion can be great for the liver. Ginger, milk thistle. She was trying these things, and despite her best efforts, and of course there are no drugs, so despite her best efforts, she was seeing a progressive elevation in indicators of liver damage that are on standard blood panels. ALP for alkaline phosphatase, ALT for alanine aminotransferase, AST, bile acids, which are supposed to be cleared from the bloodstream by the liver, and her white blood cells were increased. Meanwhile, her albumin, her protein, was dropping. That's why she was starting to get ascites. Protein is something the liver makes. So when it's dropping, you know the liver is off the clock and functioning at subpar. The white blood cell count is a tip-off, though, because her veterinarians had said, oh, this is like a congenitally small liver. They could see it on the x-ray. And so she accepted that. But the dog's white blood cell count is high. So there is an inflammatory component. Okay, so she does have this congenital microhepatica. She does have microvascular dysplasia, but she has a chronically inflamed liver at the same time. That just sounds like a big heaping plate of bad news, but this is a treatable thing. But to treat it, obviously, we're not getting the answers from Western medicine. So Dr. Karin and I, as you probably know by now, we have this set of glasses that we can put on where if we're stymied from a modern medical perspective, then we can say, well, what would a very sophisticated medical system from 1,000 years ago or 2,000 years ago have said when they weren't kind of painted into a corner by our modern medical understanding and lingo and prognostications? If we put our Chinese medical hat on, then how do we make sense of Madeleine? First of all, when you have anemia, you are literally blood deficient. So Chinese medicine called that liver blood deficiency. And so that makes perfect sense so far as Madeleine's concerned. I always say if you are understanding and doing Chinese medicine right, then when you say something from a Chinese medical perspective, it oftentimes should sound more or less like what you're saying is going on from a conventional medical perspective. The more we understand these two systems, the more they actually seem to kind of, like a Venn diagram, just progressively overlap. Anyway, where does blood come from in a Chinese medical model? It comes from the digestive organs as far as they're concerned. And the digestive organs, called the spleen and the stomach, their vision of digestion was like it was a cooking pot over top of a fire. And you had to have adequate heat, adequate energy. And if you had that, then you would sort of extract blood as from this food. You would process the food and you would extract pure substances, including blood, from the food, and that's where the blood comes from. So we know that this dog has so-called spleen qi deficiency. She has a weakened digestion. We need to spend time treating her digestion. That's the lesson of Chinese medicine here. And of course, if the spleen is not making blood, then it's making a pathological fluid. And we call that dampness. And that would be their understanding of where this ascites is coming from. Okay, so we have a recipe for success. We have a hypothesis, let's say, that if we find a liver blood tonifying, digestion supporting formula that maybe gently leaches dampness out of the system, it should help Madeleine. So what are they doing? We know that the herbs that provide that effect that I just mentioned, this kind of bolstering of the body, they need to taste sweet, and oftentimes they're aromatic, and they need to be kind of warming. So of Madeleine's current protocol, ginger, yes, warming, not so sweet. Milk thistle doesn't really have much of a taste. It's not really bringing a lot to the party. Dandelion, in there supposedly to probably drain the ascites, but what is it? It is bitter and cold from a Chinese medical perspective. That's the exact wrong flavor to give this dog. Now, most of the Western herbs that you're used to using in your dogs are bitter and cold. Taste them if you don't believe me. So a lot of them taste dandelion, or they contain dandelion or chelidonium or berberis. If you taste those drops, they probably don't taste that great unless they got a whole bunch of glycerin in there to kind of disguise the bitterness. Taste is everything. And if it tastes the wrong way, then you will get exactly the wrong results. This idea that how something tastes could be a guide to exactly what it does, not just from a Chinese medical perspective, but a real Western medical perspective. Mind-blowing. I mean, it's actually a little miracle. It's always true. Always true. There are only 5 tastes: bitter, aromatic or pungent, sweet, sour, and salty. Just 5 tastes. And those tastes all have actions in the body that are oftentimes described in circulatory terms. And it doesn't matter whether we're talking about the hundreds and hundreds of or thousands of drugs in the world or the hundreds of thousands of plant components, they never depart from that rule. It really is a little miracle. The fellow who figured this out for the Chinese, and of course it was independently discovered by other cultures through the ages, but the person who figured out this little miracle rule for the Chinese was Emperor Shennong, pictured there. He's quasi-historical figure of about 3600 BC. That's how long Chinese herbal medicine has been around, 6,000 years. We don't want to dismiss that knowledge, although in our modern medical hubris, we tend to dismiss anybody who came before us. But let me ask you this. What drugs are they going to be using 6,000 years from now? And you're thinking, are they even going to be using drugs? I have no idea. So that gives you renewed respect, because a lot of the plants that he tasted, we are using those in our modern day cases to help these animals. They have literally been helpful for thousands upon thousands of years. Okay, so back to Madeleine. What did we give her? We gave her something that is abundant in a sweet, warming, aromatic herb. That plant is called dongui, Chinese Angelica sinensis. We stopped the dandelion because even though you could justify it, say, well, I've heard it makes the liver function better and it should be able to kind of be a diuretic and pull off. You can rationalize all that stuff. But if it tastes wrong and has the wrong circulatory impact, it's going to be working against you. So we stopped it. We went ahead and gave Madeleine Xiaoyasan. We used the naturopath version here. You've probably heard Dr. Karin and I talk about the Con Essentials version called Happy Wanderer. So note that down. It's an important herbal formula. And what happened? Fast response. After 2 weeks, the vomiting had stopped, and she suddenly had enough strength now to jump back onto the furniture. She had enough muscle strength. The ascites had significantly reduced, even though we'd stopped the diuretic, because the liver is coming back online. It's making more protein. And so all that fluid is getting sucked back into her bloodstream out of her belly and being used to circulate around her body. At 6 weeks, we checked her blood tests, markedly improved liver enzyme elevations, bile acids, and white blood cells had gone down to normal. So we had resolved the inflammation. More on that in a second. And her albumin levels indeed were normal, and she was gaining weight. Long term, this was not a problem for her. Lived out her normal life. Okay, circulation then is everything. And we can look at the common scenarios that you are dealing with as a pet owner, and we can put them into kind of two camps. One is where the liver needs more blood. That's probably about half of you out there. The other half, the liver needs less blood. It's congested, and we need to move blood away. Why do you move blood away from something, at least temporarily? Think about the thumb. It's acutely inflamed and swollen. Sometimes the pileup of blood is just from congestive heart failure. Sometimes it's tumors in the liver, and the tumors have a habit of pirating the blood supply to grow themselves. So if we take the blood away from the liver, we are impoverishing that tumor and we're crippling it. And then, like I said, acute liver inflammation, cholangiohepatitis. Again, it's like hitting the liver with a hammer. So those are situations where you don't want a lot of blood, and where we would probably get more traction from using the types of Western herbs that you're used to using, your dandelion and your berberis and your chelidonium. But we actually don't have in Western herbal medicine the plants that are needed to treat the opposite situation, where the liver needs blood. And you might have heard their words microvascular dysplasia when discussing your own dog. It's those herbs which actually reverse that pathology, as they did in Madeleine. And they also reduce chronic active hepatitis, as we saw in Madeleine. So from a Chinese medical perspective, you might not be surprised to hear that blood deficiency, liver blood deficiency, is a Chinese medical diagnosis where the liver needs more blood. And then there's a handful of diagnoses, two of which we're going to talk about today, essentially blood stasis and Xiaoyang disharmony, that are the big drivers of the liver getting too congested. Xiaoyang disharmony, a common topic of conversation, asked Dr. Steve, and yet otherwise, many of you who have holistic veterinarians don't discuss it that much, especially if they're trained by particular institutes. So what's our goal? Our goal then, given that your veterinarians, if you even have a holistic veterinarian, won't necessarily have heard about this information, is for you to help yourself. So we're going to paint the picture of what does it look like when your dog has blood deficiency or your dog has this congested state, so that you'll be able to recognize the situation. We already know that you can get your hands on some herbal formulas if you don't have a sympathetic veterinarian. We're going to mention some of the heavy hitters in this talk today, but also if you like to use some other company's products, and how are you going to figure out if those products are going to be any good for you? What are some things you should be looking for? And what are some things you should not be doing? That's just as important. Okay, so let's get started. And let's get started by circling back to Madeleine's diagnosis of blood deficiency and just finish up that topic. As mentioned, blood deficiency is the driver behind microvascular dysplasia and chronic active hepatitis. How do you know your dog has this? Well, if they're a small breed dog, then very often they do. But it can be a dog of any size. You can have a 70-pound lab, and they can sometimes be blood deficient. About half the time, about half of you guys participating in this webinar, your dog probably has this liver blood deficiency thing going on. Now, I'm a big advocate of you checking your dogs. If you have elevated liver enzymes in your dog, checking them about every 3 months or so. Because when you do that, say September, December, March, June, when you do that, you will notice that there's an ebb and a flow to those liver enzymes. There's times when they improve, and there's times when they go backwards on you. That's because there's a seasonality to liver disease. Why is there a seasonality to liver disease? Because there's a seasonality to your circulation. Your peripheral circulation is great in the summertime, and it tanks in the wintertime. Well, fun fact, portal circulation, the liver gets a lot of blood supply from the digestive tract. Portal circulation and digestive tract circulation is better in the summer. So liver blood deficiency cases oftentimes get better over the summer solstice. And conversely, they get worse in the winter solstice when that peripheral blood supply, that blood supply to the digestive tract and thus to the liver, is the most compromised. So get in the habit of checking every few months. And if you find that your dog's liver enzymes are definitely worse, say November, December, January, and they definitely seem typically better, April, May, June, July, then this is what you're dealing with. Also, if your dog is panting or just opens their mouth like this little puppy here, take a look at the tongue. And if the tongue looks a little washed out, a little pale, then it makes it more likely that you're dealing with blood deficiency. Behavior. Behavior is a big tip off to the blood deficient case. A lot of these dogs are anxious. And I got a picture there of the brain, because we've been talking about how blood deficiency, logically, has reduced peripheral circulation. Well, that is not just true to your skin and your fingers and the lining of your digestive tract and your tips of your ears. It's also true to the brain. It's easier for the blood supply to kind of, get to the brain stem, those kind of purple, those kind of pinky reddy circular objects in the picture there. Those are the centers where emotions are felt, anxiety, as an example. The cortex, you can see the cortex is not nearly as advanced as yours. Probably most of it devoted to treats. Nevertheless, the cortex is the rational centers of the brain that can override the core of the brain, the amygdala, where all those emotions are happening and fomenting. If you could, but the cortical layers of the brain, which are more peripheral, they need blood, right? Resources, oxygen, energy, in order to switch on the rational centers of a dog's brain so it can say to these emotional centers, calm down, it's going to be okay. Don't be so triggered. If a dog has reduced peripheral circulation tendencies because they're blood deficient, they have reduced cortical blood flow, particularly that prefrontal cortex, which you can kind of see there right in the region of the eye where your third eyelid is, your third eye is. If they have reduced circulation there, then they're a victim of their emotions. So these dogs are often anxious, and they may actually like to be confined. They like to, definitely if your dog is calmer when it's kenneled, then they're blood deficient. Why are they calmer when they're kenneled? Because they're anxious. And when you're anxious, the world is just going to attack you unless you're in a kennel and there's just one way in. There's only one area you have to worry about, and you can just relax about all these other quarters. So they oftentimes like to be kenneled or are calmer when they're kenneled. In the ancient classics, which, as you know, is where Dr. Carr and I base all of our practice from, in these ancient classics, they talked about how the person with blood deficiency has a sense of smallness. They feel physically small. Dogs tend to compensate for that sense of smallness by being territorial and particularly by resource guarding. I can remember one Chihuahua client of, not the client, the patient was a Chihuahua, resource guarding Chihuahua. And if they went to the grocery store and they made the mistake of putting the bag on the kitchen floor when they got home, that Chihuahua would not let them near that bag because he wanted it all for himself. So if you don't put the groceries on the floor, if you're in that household, and if you do, make sure it's not the ice cream because you're not getting near that for several hours. So we treated that dog for liver blood deficiency, and it really improved their ice cream budget. So this kind of these dogs will oftentimes strike first. They'll do bluff charges. They'll try to intimidate because secretly they feel a sense of smallness. They will nip at your heels when your back is turned because they figure it's finally safe to do so. You know, they want to be openly confrontational, but they'll happily nip your butt as you're walking away. These are just some of the behavioral traits. I'm sure a lot of you can relate to what I'm discussing. They oftentimes dream vividly. So they'll be twitching and jerking, when they're asleep, having, vivid dreams. We assume they're dreaming vividly because women are very commonly blood deficient, and women tend to dream much more vividly than men who tend not to be very blood deficient. When they are anxious, they're not oftentimes over the top, extreme reactivity. Usually when something's that bad, then there's another cause. And maybe we can have a webinar sometime where we talk about behavioral issues. Lastly, these guys oftentimes will feel a little punky in the mornings. They feel a little hungover. Why? Because we still don't have great peripheral circulation in the morning. And we know that peripheral circulation is where we actually get the blood supply looping through the digestive tract and then back into the liver. So if that's not happening, then they're feeling a little toxic and hungover. So I know we took a long time on that slide, but sometimes these behavioral traits are the easiest way to kind of recognize this disorder. But many of you do lab tests. And so here's some other things you will notice that can kind of corroborate your suspicions. The shredded red blood cells, the so-called microcytosis and anemia that we mentioned with reference to Madeleine. Things that the liver makes may oftentimes be low. In Madeleine's case, it was albumin. BUN, or cholesterol, is commonly low in dogs with liver blood deficiency. They oftentimes have elevated liver enzymes like ALT, especially in young animals, but these are usually not off the chart elevations. They're maybe, 2 times normal, 3 times normal max, but oftentimes not more than that. So if a normal ALT level was 60 or something, you might be seeing them at 180, but you're not going to be seeing them at 580 if they have liver blood deficiency. Serum bile acids are oftentimes elevated. Why? Because you get these bile acids, they're absorbed from your digestive tract. They're supposed to circulate through the liver, and the liver is supposed to siphon them back off. If you don't have the liver circulation to do that, then bile acids stay elevated. Sometimes you actually have direct evidence the liver is small and lacking blood from ultrasounds, from x-rays. Sometimes in ultrasounds, they'll even do Doppler studies where they can visualize the blood vessels going through the liver, and they will look visibly attenuated. So there's a lot of different objective ways of determining whether your dog has liver blood deficiency. When we treat these guys, as mentioned, we want to be using these sweet, warming aromatic herbs. Also, sweet and sour is a very nourishing, hydrating flavor combination. The top picture there, that's baishao, white peony, the same peony you have growing in your garden. The root is a 2,000-year-old remedy for the liver, more sour tasting than sweet. But dongui, that I mentioned earlier with Madeleine, that's the bottom picture. Put those two kids together and you're really got something going. And they are together in Xiao San, which translates to rambling ease combination, or happy wanderer if it's made by Con Essentials. Another English name for Xiao San is Buflurm and dongui. What's the safest formula to try to treat liver blood deficiency in your dog? It's that formula. Let's look at another case that's a little harder to figure out. It took me a long time. It's actually an associate of mine that figured this case out. But now I have 20/20 hindsight. I can tell you what happened now. I just couldn't tell you what was happening then. So Jock, an 8-year-old male neutered Cairn Terrier with chronic active hepatitis. And his liver enzyme elevations were first identified on routine blood testing. That's very typical for chronic active hepatitis. You otherwise have no idea that something is going on. So here's a hint for you. If there's no outward evidence of some sort of brewing problem, it's probably a deficiency. Okay. The laboratory changes didn't really suggest blood deficiency. Why? Because ALT was much higher than 2 or 3 times the elevations. And the cholesterol was also elevated as opposed to being low. Bile acids later became high normal, but they weren't, kind of elevated like we would normally expect. Copper and zinc levels were normal. The dog had normal blood clotting. Milk thistle and SAMe were tried, and of course, they don't produce a benefit. So I didn't really know what to do with him. I wasn't thinking blood deficiency because I didn't know enough back then. You're learning from my mistakes. It was on the imaging studies that we figured Jock out. So he had a hyperechoic liver. That means it looked whiter on an ultrasound, like sound waves are reflecting back off it. The liver was more dense than is normal, but there were spots inside those densities that, if anything, looked like there's a little less in them. Hypoechoic nodules. The liver looked normal in size, but they were able to assess that the blood supply looked attenuated. The biopsy showed a chronically inflamed liver. Now with fibrosis setting in, scar tissue setting in, that's what the sound waves are hitting and bouncing off of to produce this hyperechoic picture. They're hitting scar tissue, and scar tissue is kind of dense and tough, and so ultrasound bounces off it. And again, on biopsy, they said, wow, there's a lot fewer blood vessels than there should be. So we know for sure the dog has liver blood deficiency. It's just that this dog has progressed to a more inflamed state. So there are other formulas containing dongwei and even peony that we should be able to use, such as Angelica and peony powder. Didn't do a thing for him. Why? Because he's already moved through the state that Madeleine was in. He's already started to get a cirrhotic liver as his problems are becoming more entrenched and more severe. So we used Xiaoyasan on him as well. Why did it work for him? Same reason it worked for Madeleine. The bupleurum in there gives it a bit of an anti-inflammatory edge, even as the formula overall is restoring a normal blood supply. So bupleurum, which we're going to come back to in a second, turns out to be a very important liver anti-inflammatory. Once we realized what needed to be done, we put him on Xiaoyasan and cut his ALT levels in half. A year later, because he never was really feeling sick, he continued to remain asymptomatic, but we could see his liver enzymes were slashed in half, and he went on to live his normal life. Okay. Both Jock and Maggie had not just this attenuated blood supply, but also this inflammation. And if that inflammation is there long enough, it leads to scarring. And if the scarring is bad enough, it leads to something called cirrhosis. So that's a progression from I don't have a very good blood supply to now I'm inflamed to now I'm all scarred up. It's the same disease process. And that disease process is caused by the blood vessels, as per that last ultrasound, being too small. And what an ultrasound can't show you is that the blood vessels are also leaky. And by leaking, I don't just mean fluid, edema, I mean white blood cells. And when white blood cells leak out of the blood supply, they get into the surrounding tissues and they just start to damage stuff. That's all they know how to do. They're a hammer looking, and everything seems like a nail, and they start hitting things. So that's what sets up this chronic inflammatory state. And then if it just keeps going because you don't fix the tiny leaky vessel problem, then it eventually turns into cirrhosis, and you suddenly have a dog that does look sick and they have liver failure. So Jock was on his way to cirrhosis, but wasn't sick with it yet. And he was still at the stage where if we just fix the tiny leaky vessels, he'll do better. And that's what the Xiaoyasan was all about. There's another formula that some of you may be familiar with that combines dongwei, lots of it, with bupleurum, lots of it, and that's called Cesarex. So In a situation where you would use Happy Wanderer, you could use Cesarex instead, especially if they're not like Madeleine. So Madeleine was emaciated and she was throwing up and she had no appetite and she really needed her cooking pot, her digestion supported. But a lot of dogs are like Jock, where they don't particularly have a weak digestive tract. They just have the liver compromised circulation, and all this results in inflammation. So that commonly happens in chronic active hepatitis, which is a very common disorder. And it will also happen in a lot of autoimmune disease of the liver, which is a very common diagnosis as well that veterinarians are making. So if your dog has been diagnosed with immune-mediated liver disease, Cesarex is actually probably better than Shaosan for treating your dog, rich in both of those heavy hitting herbs. Some of you have asked just over the posts and over the years, is Cesarex okay for dogs with liver disease? And the answer is yes, because even though they don't have a liver disease that Cesarex treats, we have a herb in there that decongests and a herb in there that supports circulation. They have a balanced effect on circulation. They whatever is wrong, your liver is going to be fine. It's essentially the message by putting both bupleurum and dongui in the same bottle. Okay, where does this thing come from? The tiny leaky vessels. What's the origin of that? It's the food. There's the medical term for these tiny leaky vessels is called endothelial dysfunction. I know it's kind of a bewildering diagram here, but here's the upshot. Endothelial dysfunction, the malfunctioning of the blood vessels, it happens for a couple of reasons. Number one, chronically elevated blood sugar, and number two, chronically elevated insulin levels. When dogs eat processed foods every day, all day, for years and years and years and years, those foods are very rapidly assimilated. They're heavily processed. They're into their system within 15 or 20 minutes. They're starting to be absorbed and are coming in at a rush because they're tiny little particles that break apart almost instantly in the digestive tract and are absorbed very readily. So that tends to push blood sugar up. It tends to push insulin levels up. And that's happening every single meal of every single day of every single year. And this is what is driving the process of endothelial dysfunction. So what's the diet then that would, if we're to put Jock on a diet to kind of undermine this tendency towards chronic active hepatitis, what should it be? It should be real food, unprocessed. It can be cooked. It can be raw. It can be, as long as it's balanced, use any brand you like, as long as it's whatever protein sources you're happy with. The main consideration does the dog finally have to work for its food? Does the dog finally have to, instead of it being absorbed within 15 or 20 minutes, is that meat still in the stomach like a half an hour, 45 minutes, an hour later? Are they still working at it? It's a much slower digestion, much slower assimilation that is A, much easier on the system, and B, as a result, blood sugar levels are staying normal. Insulin levels are staying normal. And as a result of that, we don't have the forces driving the formation of endothelial dysfunction. Feed your dogs real food in order to stop this process. So unfortunately, a lot of the supplements that we use in our liver dogs, they tend not to work if they don't have this vascular impact in mind. There is one supplement, though, that you could consider that is kind of like the Happy Wanderer, the Cesarex, the Shaoyasan, and that is melatonin, interestingly. Melatonin has some of this liver anti-inflammatory peripheral circulation enhancing effects. So if you have melatonin on yourself, you could go ahead and supplement that. It's not going to work anywhere near as well as the herbs we've described, but it will work with those formulas to maybe achieve a better result. Okay. What about the opposite situation? We talked about how if you don't have enough blood in your liver, now let's talk about you've got way, way too much. You've got cirrhosis, or you've got tumors, or you've got acute inflammation, or you've got a liver that's full of blood because of impaired peripheral circulation. That's what we're going to talk about next. What do you do about that? How do you even know that that is what is going on? And as we mentioned with Jock, this is kind of a progression. I mean, on the one hand, it's two different things, right? Blood deficiency and blood excess, so-called blood stasis. But they are a progression. We saw that in Jock, that he was progressing from blood deficiency. We don't have any drugs to help him. So we just let the inflammation smolder, and slowly he becomes cirrhotic. And eventually he was converting into the excess state. Sometimes that chronic inflammation, instead of causing scar tissue, causes tumors. I'm going to show you a case of that shortly. And then if we have the immune system also happening to be activated or agitated as a result of all this chronic liver damage, then we have this added element to things. They did a study on hepatitis C patients where they looked at what was happening to their immune system as a result of this chronic, never-ending liver damage. And the immune system was starting to get sensitized to all these little fragments of liver floating around in the bloodstream and starting to attack the liver, starting to think that it was something foreign. So after a while, the immune system starts to attack the liver, and we get more of an immune-mediated spin on things. And of course, that just continues to drive inflammation and damage and the risk of tumors and cirrhosis. Okay, so all these things are kind of interconnected. That last one, Xiaoyang disharmony, that's actually super important. You've heard me talk about it a zillion times on Ask Dr. Steve, and Dr. Karin talks about it too. What is that exactly? I kind of get the blood stasis, I kind of get the blood deficiency, but what's this Xiaoyang disharmony business? Think about your average river flowing through a landscape. What creates the energy that drives the flow of water? Essentially, it's gravity. The early Chinese, they said the body is an inner landscape. It must function more or less the same as the exterior landscape. So what is the energy that drives circulation in the body? It's yang energy. And whatever controls yang energy, thus controls water flow, controls blood flow in body. So that controller of yang energy, the thing that limits or kind of funnels is kind of like this narrowing, this weir or this dam that controls the flow of yang energy to the body's surface, and this peripheral blood flow, the blood flow to the liver, etc. Those are called Xiaoyang structures. So when that is impaired, then we have yang piled up in the body interior. When that happens, we have blood piled up in the body interior, and all that heat and all that blood creates a situation of severe acute inflammation. So some of the nastiest things that we encounter, such as severe pancreatitis, severe hepatitis, nephritis, those are Xiaoyang disharmonies. Lots of yang energy trapped in the interior, lots of blood trapped in the interior, all that heat and blood creating the equivalent of a sore thumb, a hammer hit thumb in the interior of the body. So how do you recognize if this bottling up of blood supply in the interior, how do you recognize whether your dog needs this decongesting type of influence? And by the by, this is the situation where the standard things that we use from the Western herbal materia medica, like the chelidonium and the berberis and the dandelion, this is when those herbs are more useful, is in these more acute, severe inflammation situations. These are more apt to occur, this congestion of the liver in the fall, winter, spring, when peripheral circulation is weakest, the blood's all piled up in the interior and making the animal more prone to this acute inflammation, the swollen thumb. They oftentimes improve in the summertime because your peripheral circulation is better. So it takes the pressure off. The blood has someplace to go. The tongue, We mentioned in a small breed dog is oftentimes pale if they're blood deficient. But in these dogs, they'll oftentimes look very purple and red, signifying this severe stasis, this buildup of blood and this buildup of heat in the body interior. And the liver oftentimes looks big on an ultrasound, and so does the spleen frequently. Okay, what are some other things that would tell you, because you may not have access to expertise, tell you that your dog has this kind of situation going on? Well, number one, you're worried. These guys are oftentimes pretty sick. So not just one organ even, pancreatitis, hepatitis, nephritis. Liver enzyme elevations are usually very high. So now we're talking 5, 6, 8, 10 times normal. No problem at all. They're oftentimes painful and they're restless. They can't get comfortable. They're panting a lot. There could be jaundice if things are really bad. And this is where we get certain diagnoses cropping up, such as immune-mediated disorders, tumors being visible on x-rays. Copper toxicosis presents like this if it's bad enough. I have not yet found a case where people could get by without chelating copper. But fortunately, that's an oral medication, and the chelation of copper coupled with herbal therapy will oftentimes take those animals and put them all the way back to normal. Cirrhosis is another common diagnosis, as well as mucoceles. This is a Karin case. Dr. Karin has a real love of greyhounds. Well, she has a real love of pretty much every dog on the planet, let's face it. And they love her. However, one of her first loves as a dog owner were greyhounds. And so when Appalonia came into our clinic, she's like, we have to take her home. We have to heal her. So Appalonia actually stayed in our mud room for several days when she was critically ill, because we didn't feel like if we handed her over to an emergency clinic that they would do a good job of treating her, because we used herbal medicine and we were giving her herbal medicine enemas in order to get the herbs in large portions into her system quickly. It's kind of like a herbal IV. So Appalonia, what's the story with her? She's a 6-year-old intact female greyhound. Chief complaint, severe inflammation and liver failure. It's suspected that there's this immune involvement. So as soon as you're thinking there's an immune system issue, then you want to be thinking about these sort of blood stasis approaches that we're talking about now. In this case, it wasn't an autoimmune attack on her liver. She was profoundly immune deficient. She just wasn't able to get rid of infection. So she's having these recurrent abscesses and draining tracts for years, despite multiple antibiotics. Antibiotics don't work if you're immune deficient. They really do a poor job of getting rid of an infection. Antibiotics need a competent immune system in order to do their best work. So, and then she eventually ended up with an actinomyces infection, which is kind of this opportunist. It's like a bug that shows up only when an immune system is basically shut down. So she has severe inflammation. She has this apparent immune deficiency. Right away, we kind of know what we should be doing for her. This is not a Madeleine case. This is not a Jock case. This is a severe liver congestion and inflammation case. We need to use totally different strategies. And her last infection happened in the middle of winter. And that's when this event got precipitated, was shortly afterwards. So middle of winter, when problems show up in the middle of winter, again, suggests that you're dealing with a severe acute inflammation and congestion, and you need to be moving blood out of the liver. So 2 weeks after that failure to get rid of that infection, she started vomiting up blood, no response to antibiotics. She had diarrhea. Her ALT was 10 times normal. Her ALK-Phos was 6 times normal. Her bilirubin was off the charts. It wasn't even readable. And her kidneys were starting to fail. So her creatinine was, 3 or 4 times normal. She was dehydrated. She was panting, collapsed, jaundiced, tachycardic, and yet somehow low body temperature with a lot of abdominal pain. She was a mess. So Karin has a massively big heart. That's why she spends so much time in Ask Dr. Steve. And she just could not let this dog succumb. So she said, we have to take this dog home. And I don't really care what you say. I'm telling you, I'm not asking you. Because she's got red hair. And so that's how things go in our house. But I'm fine with it. Because, generally she's right. We gave her fluid therapy. We gave her acupuncture 2 or 3 times a day because you can use acupuncture to achieve results in emergencies. She did go on to IV antibiotics because we could not. But what are the chances that's going to help? Not a lot. We gave her an analgesic just because of the extreme abdominal pain she was in. But the big player was minor bupleurum. So minor bupleurum is the core formula of Voltrex. And that's what we're giving her rectally. And that is what saved this dog's life. She did get some homeopathic nux vomica during her last day just to kind of resolve some lingering regurgitation tendencies. I'll tell you more about that shortly. Meanwhile, though, what about this minor bupleurum Voltrex business? Again, another 2,000-year-old formula. This happens to be extensively researched by the Japanese for the treatment of immune-mediated hepatitis, which oftentimes is hepatitis C. So it's a big formula for the treatment of hepatitis C in Japan with a lot of research behind it. It doesn't have sweet herbs in it particularly. These are aromatic and they're bitter. And so that makes it a moving anti-inflammatory formula. We don't use this formula all by itself in dogs with gastric ulcers. Because dogs with gastric ulcers, they need something in addition they need a tonic. They need something sweet to kind of moisten the stomach lining. So those of you, and ask Dr. Steve, you're familiar with the fact that we use Glenia and Romania, a Con Essentials formula, along with Voltrex, to treat dogs with gastric ulceration as well as all these other internal organ issues. But if you don't have that going on, it's a great choice. You can also, if you do have all that going on, the ulcerated gastrointestinal tract, you can just use plain old minor bupleurum. For those of you who don't have holistic veterinarians that you can access, you can get the Con Essentials version called Harmonize the Chi. As you might have guessed, if we're featuring her in a webinar, Appalonia got better. What's amazing is how fast she got better because she was tanking. And within 4 days, the vomiting and diarrhea had stopped. Those abscesses on her body had healed. Her ALT was, dropped by 40%. Alk Phos was still increased. Total bilirubin at least now is readable, but still way high. But after 1 month, dog is normal. So here's her blood work from January 5th to February 7th. And you can see how she went from these profound elevations in ALT and alkaline phosphatase and total bilirubin and BUN and creatinine, how they just went all the way down to normal under the influence of that minor bupleurum. Meanwhile, albumin, which was very low, just like with Madeleine, because the liver was starting to fail, that went all the way up to 39, very normal. And cholesterol, which had been dropping because the liver was failing and no longer able to make anything, was similarly shot up all the way to normal. So that is the story of Appalonia, a very happy dog. Day 4, we knew it was time to send her back to her owners when she slipped the leash out in front of our house and went running down the street. And then it was, okay, you are healthy enough to go back to your mom. Here's Abercrombie. Abercrombie is another blood stasis case. I mentioned that we have a cancer case. This is a cancer case. A 14-and-a-half-year-old male-neutered Lhasa Apso with a tremendous sense of style. And he has hepatic adenocarcinoma. He'd had a chronically smoldering liver in the past. So you definitely need to be trying to get on top of that. For a long time, he was a blood-deficient dog. And Xiaoyasan would have been a good thing to use on him on a consistent basis. We know that if you start with blood deficiency, you end up with chronic inflammation, and chronic inflammation can lead you to cancer formation and scar tissue formation. In Abercrombie's situation, it was cancer formation. He looks kind of like Appalonia in the sense that restless, panting, uncomfortable. a discolored tongue. You can always find a reason for your dog looking painful. I've never found a pet owner who says, I just don't know why they're painful. You'll always, and in case of Abercrombie, they thought he'd eaten a cactus, which, yeah, admittedly, that would make you uncomfortable. But that it's almost always the reason you're thinking for your animal being painful is usually not it. So definitely go to the vet. He had these dramatically elevated alk phos levels, 10 times normal. He had low thyroid levels. Why? Because if you have terrible circulation to your liver, thyroid levels start to drop. Because thyroid levels, one of the things that raises your thyroid levels is being able to actually activate thyroid hormone, and that happens as blood is flowing through the liver. This is very common for dogs with these liver issues to have hypothyroidism. The ultrasound showed a big mass in the left liver lobe, and it was already beginning to invade the portal vein. That meant surgery was basically off the table, extremely risky. With surgery, if things are not that bad, you can get a year to 2 years out of these guys. But without surgery, the prognosis is grim. So we decided to try and treat him with holistic medicine. But again, we can't just use off-the-rack supplements. We need to think about what do we need to happen from a blood flow perspective. From a blood flow perspective, what tumors are great at is taking the blood supply unto themselves and growing as a result. So we need to pull blood away from the liver to compromise that tumor, to say, oh, no, you don't, and to take that blood and move it out of the liver to the body periphery. We needed to treat the blood stasis. The blood stasis was signified, like I said, by the pain, the irritability, the restlessness, and that purple-red tongue. We gave him dispel stasis in the middle palace. Gush Yad Zuyatong, we gave him the naturopath version of the formula. But you've heard Dr. Karin and I mention the Con Essentials version of this, dispel stasis in the middle palace. We use this all the time for liver cancer. And I would say we actually, these days, also team it with Voltrex, or at least with Harmonize the Chi, with minor bupleurum, in other words, to get added anti-cancer punch. He did great. He did as good as if he'd had a surgery. So he eventually passed away at almost 17 years of age. But we were able to get on top of that tumor quite handily and quite quickly. You can see the extreme liver enzyme elevation there. And you can see how we started treatment in February. Remember, midwinter is when things get bad with these congested liver conditions. So we were able to, by the time April rolled around, or June, we were able to get his liver enzymes back down to where they had been before all of this happened. And as I said, these days we would add Voltrex or add minor bupleurum for its added anti-cancer effects. Okay, so just wrapping it up then, what about milk thistle? Is that okay? Like, we're saying we're solving these problems with everything but milk thistle. Is it useless? It's not useless. But it's important for you to realize that despite the fact that it seems to be all that veterinarians know how to prescribe, it usually does not work. And many of you have probably figured that out. What does it do? It stabilizes liver cells to help stop them from rupture, from popping. It is especially likely to do that when the liver has been poisoned. So what are the main things that will poison the liver? Dogs that eat toadstools, dogs that eat poisonous mushrooms in general, dogs that eat moldy, garbagey foods. Those are the things that cause a toxic insult to the liver. Milk thistle, great for dealing with that situation. Doesn't really help us that much with liver inflammation of any other cause. So am I saying don't use it? No, I'm saying go ahead, because it might help a little bit. It never is harmful. It's never the wrong thing to do. It's just often not the right thing to do. By the by, I mentioned this, we would get to this before, homeopathic Nux vomica. Now, if you're in Canada, that's oftentimes sold as Colubrina, Colubrina. Homeopathic Nux vomica, I use 30C strength. It's great for a toxic liver, an animal that's got a degree of toxicity because of some degree of liver hypofunction, liver failure. Keep that in mind. Use it 2 or 3 times a day. It worked really well to kind of get rid of Apollonia's nausea. Use it as well for these liver toxicity cases. Karin and I had mentioned that Karin's first love was greyhounds. Her second love was a Dalmatian named Zoe. One day, soon after we moved to Edmonton, Alberta, Canada, to start our clinic there, Zoe became ill. She went into liver failure, and we could not figure out why. We didn't know what to do for her. She wasn't responding to any herbal formulas. Mind you, we didn't know then what we know now, but still, she should have been responding, and she wasn't. And I can remember going and sitting on the back steps of this little 700 square foot house that we were renting and looking at the lawn absent-mindedly and just thinking, what can I do for Zoe? And I noticed the lawn looked different than it did the day before. The day before, there were a whole bunch of little tiny mushrooms sprouting up in the lawn. 24 hours later, they were gone. And I thought, Zoe ate everything. She ate an entire bottle, I think Karin can confirm, of like meloxicam or something. That should have almost done her in. And milk thistle saved her then too, because it's in a toxicity situation. Once Karin was saying she ate an entire bag of kibble, and Karin came home from wherever she was, veterinary college or something, and a dog is just lying on the floor with this massively distended abdomen that you could see little profiles of kibbles poking through the thin stretched wall. And Zoe just like lifted her tail a couple of times as if to say, yeah, I'm probably going to die, but this is the way I have chosen to go. Anyway, she didn't die. And she didn't die that day either. I came back in the kitchen door of the house and said, she's poisoned herself with mushrooms. And so we loaded her up on milk thistle. We gave her a bunch of Nux vomica, turned around incredibly rapidly. And Zoe was once again snatched from the brink of death. So, especially suited to toxicity, which does sometimes happen, drugs, mushrooms, aflatoxins, etc., but it's never a bad idea to use it. But otherwise, if it's not that situation, it may not help, as many of you have probably noticed. Can you use other companies' products? Yes, of course. I prefer to use classical formulas that are changed very little from what was originally written down about them. Why? Because the ancient Chinese had this blood flow thing figured out. And so always in the formula's design was this prevailing concept of where's the blood? Where do we need it? How are we going to correct it or create this formula to help? So unfortunately, a lot of companies don't do that. But you now know what is a healthy looking herb, or what are the herbs that increase blood flow? What are the herbs that de-inflame, decongest? Hopefully now you can begin to kind of look at the labels and make your own mind up about it. Okay, and if you do the wrong thing, that's okay, because the wrong thing, if the liver enzymes go up, you push blood into the liver and the liver enzymes go up 2 or 3 weeks later, that's okay. Just do the opposite. Use those decongesting strategies we talked about. So don't obsess about doing the wrong thing, but do check liver enzymes after you make a move.